kids generally don't like to eat veggie. They look at veggie, they run the other side. So those contributes to constipation. Hi, I'm Dr. Daniel here. I'm a pediatric surgeon in Hospital Pantai KL. I'm here to answer you all the questions about pediatric surgery. Shoot at me. How often should my child have bowel movement? So technically it depends on the age of your child. If your child is a baby, it should be about 4 to 5 times a day. But if it's about a year or less than that, it's about 3 times a day. Something more than a year, it's about 2 times a day. But the real question is, it's not how often, but it's what is the quality of the poop. If the child poops hard like a stone, even if they poop every day, I will still say your child is constipated. Could constipation be a sign of more serious medical issue? Yes. So constipation in children, there's 2 main branch. One, you have a habitual. Kids generally don't like to eat veggie. They look at veggie, they just take a dash, they run the other side. So those contributes to constipation. Personally, I feel the habitual is a bigger issue than the second one, where you have a secondary cause. It could be something like you have low calcium, it could be something like your thyroid function is low. See, those things we can test and we can treat. Is anesthesia safe for younger children? Yes, anesthesia is safe for young children, provided that we do not prolong the surgery. What are the potential benefits of circumcision? So generally, the prepuce or the foreskin, it can be a harbinger for bacteria to colonize. So risk of getting urinary tract infection is slightly higher, and then when you grew up, the risk of sexually transmitted disease is slightly higher. Hence why some cultures recommend you to do circumcision. Why does my child penile balloon during urination? The foreskin kind of guides you to pass urine. But if the foreskin becomes tight for any particular reason, you can have a repetitive infection, so that holes become smaller. So when you shoot urine, it doesn't flow as normal, it tends to collect and the penis used to balloon. Why does my child keep vomiting after eating? For babies, the tummy also connected to the food tract. When the tummy wants to push the milk down, sometimes inevitably the milk goes up. They then tend to vomit. So that's why it's paramountly important for baby, after you feed, you need to burp them. Can hernia go away on its own, or will it always require a treatment? Hernia does not go away. There are a lot of myth out there saying that let's go and massage. Hernia as a whole, where the contents, generally your bowel, goes in and out. As long as something goes in and out, the possibility of its closing is really low, almost non-existent. What are the risks of delaying a bowel-related surgery? Imagine if you have a problem, a blockage, which means you cannot poop, or if you have like the discontinuity of bowel, and this will just cause you to become more ill. So when you have a bowel-related problem, some require surgery, some doesn't. But whatever it is, it almost invariably needs a treatment. So those are the questions that I have today and I've answered. But if you do have any more questions, put in the comment below. Till then, take care. Bye.